All right, continuing on because I got cut off because I'm terrible at finding software that can record more than 5 minutes. I guess you have to pay for it, and I'm cheap, so here we are. I was saying a dystrophic nail here is due to proximal or distal nail dystrophy. Matrical disease. So you have a dystrophic nail plate here. You know that there's matrical disease here. So you have a wide band of dystrophy. You know it's a matrical disorder. If you float your eyes up here to the proximal nail fold, you can see that there is some type of mass or growth that's likely under the skin sitting on the matrix, probably a proliferation of some type of matrical growth that's causing the dystrophy that you see here distally. And usually this pattern of this kind of wide yellow dystrophy on the lateral nail fold with hemorrhage is compatible with the onychomicrocoma. I did avulse the nail and do a matrical biopsy, which confirmed onychomicrocoma. Here, I think, is the last case, an interesting case we actually saw on consults. I thought it was just neat because, again, just emphasizing not just skin, but also hair, nails, and mucosa. And here we were consulted with concern for oral candidiasis. You see this kind of shaggy, white, fibrin base plaque on the lateral aspect of the tongue. And then immediately you should ask yourself, why is this localized to the lateral aspect of the tongue? What's unique to that area? Why is this not dorsally located? So something like oral candidiasis is usually going to be more midline or throughout or dorsally located on the tongue. When you think about lateral, you think about that's where the teeth, especially the molars, are going to be pushing upon the tongue. So this is going to be more consistent with some type of repetitive chewing or biting behavior called morsicatio. You can have repetitive biting on the tongue, which is called morsicatio linguum, and then if it's on the buccal mucosa, it's named Baccarum, something similar to that. It's just named in different locations based on what the actual chewing entity is. But on recognition of this entity, we asked the patient, and it turns out they endorsed that they were kind of chewing on their tongue as a nervous habit. So kind of interesting, saves the patient from going down the wrong route, having an unnecessary medicine, and can be treated appropriately. It's benign. It doesn't really have like pre-malignant potential. If the patient is not bothered by it, you don't necessarily need to treat it. All right, so those were just 5 quick hit Kodachromes to try to get back into things. Hope you enjoy the video.